Chris reliably informs me you've read every page of the 5-year forward view. Well, even if you haven't, quite frankly, a lot of what's in there has been written many times over the years. It's not brand new. How are we actually going to get this done? We need more instinctive collaboration around how stuff gets done. We need recognition of mutual interdependency in this system, and probably more EQ than IQ. It's a massively challenging time. The progress, the sheer hard work of everybody in the health system, I think needs to be applauded. But I think the challenge to me is that anything on the scale of the NHS, with its diversity, with its discontinuity of patient journeys, and the systemic damage that done by outliers, are really, really critical things that need to be fixed. For those that constructed the 5-year forward view, we start from the premise that everything that we do now has to be mapped onto the 5-year forward view. We cannot continue to be the healer of last resort in the health system. I think we need a real conversation with the public, whether it's local action, whether it's advertising, whether it's using the tax regime, whether it's incentivising employers, whether it's actually youth education and bringing together the alignment of sport, health and education. All of those things are capable of influencing the demand curve, and we have to try over a long period of time to bend that curve of demand. I think we need a much higher connected government, and I think hopefully one of the things that we will get to with the next government is a much more focused effort on joining up. Because if we are joining up from where we sit, we do, and I hope the public expects, that we will see much greater joined up government. We have to have full transparency. I mean, we're a publicly funded system. We have a duty and an obligation to be transparent in what we do. I would argue, in the same way that NHS England holds board meetings in public, it's transparent, we should just make that a standard across the systems of public services in this country. How do you implement some of these new care models? The second big theme in the 5-year view after demand. And I do think it's about detailed prototyping. We've often had prototyping, but not at a level of detail that enables you to follow through fastly, and it does require that discipline and then the follow through. A shared methodology. I went to Yeovil Hospital and spent a day with the board and the hospital staff and wandered around, and what they were doing for the local health economy was responding entirely to their population, to the elder care. They were bringing, completely revamped their dementia environment, bringing residential care onto the site, moving primary care right closer to the site, jettisoning things that they couldn't do in that hospital and getting them done at Dorset General. You know, that's a great model of responding to care. And of course, there are many examples of that, and Yeovil is not unique in this country. And then what's the role of the national and regional expertise? And I think it's there to support, it's not to control. The NHS is running really hot. It does not have the funding to fund transition. And as you go through transition, you always get this bell curve of costs before you get to another world. So I think, sadly, government accounting works against this concept of spend to save and stuff. But we have to get to a world where we are accountable for funding a transition cost element of the change process. The time horizons of governments, of politicians, of leaders is often not consistent, indeed the public, with actually the challenges of execution. The health system is not an SME where you can turn the driving wheel and the wheels move and the car goes in an entirely different direction. But I would say, do we ourselves overcomplicate? Do we over-perfect? Do we seek to over-control the solutions? And should some of our should we just lighten up and look at our risk appetite for getting stuff done? One of the first things I was asked to do was look at technology, and technology was siloed. And so we did a review, we got to a National Information Board. There's been a huge collective effort to get to the report published today. The health system is littered with failed IT projects. It shouldn't be that difficult to learn why, and I think it's to do with the fact that we tried to have big bang every time as opposed to agility. And I don't think yet we have joined the dots on the implementation of technology and worked out whether cost comes out of the system or cost is redirected to greater, better activities. In the NHS, my view is that we have a tight culture driven by metrics. That's different, to my view, to having standards, to working to outcomes, to facilitating rapid and detailed prototyping of solutions, which can then be industrialised. And I think almost the hardest thing that a leader of an organisation can do is let go, but it's almost the most important thing that a leader can do. I take the view that trust is like oxygen. It's vital, but it's unnoticed until it goes missing. The regulatory reflex when trust declines is to increase regulation. That's what the attempt to repair trust drives regulators to do. My view, long held, is that actually undermines the real basis of trust in systems. The intrinsic trust in organisations and their leaders. And I think over-regulating professionals can erode the foundation of their work. People switch off. The more we rely on rule following to shore up trust, I would actually argue the less likely trust will be based on assumed integrity. So the model we produced was let's start with self-regulation, let's work with peer regulation, then yes, of course, let's use state regulation as the fill-in. Unfortunately, I think we have the reverse. I think rules have become the dominant axis of running organisations. I think that's what leaders, again, a bit like regulation, leaders reflex into rules. But if we think the intent of an organisation at its stage of development is to access customers more, to increase knowledge transfer, to enhance collaboration, to increase and deepen innovation, and to drive serious leadership development, funnily enough, things that are quite critical in the 5-year forward view, then you have to work on much more on instincts and behaviours as drivers of organisational performance. Final thoughts, really. Treat people as the answer, not the problem. Treat people with dignity. Treat people, I think, as inherently trustworthy. So very finally, if we all wait until we all fully aligned, hold hands, embraced, have nodded our heads time and time again, let's just go and do it against those 3 buckets of the 5-year forward view. Thank you very much.